Dear colleagues, welcome to this recorded introduction to overview the extended modular program. You are expected to watch this presentation before attending the training. It will provide you with the basic information about the program and will help you to better engage during the face-to-face sessions. It will save you valuable time for active, focused discussions and training activities. A copy of this slide has been mailed to all of you. Please read our mission, vision, and values. It is clearly related to the vision, mission, and values of our faculty, and we mean every word of it. The ultimate goal of our mission is to develop a lifelong learner. Motivation helps to create an enjoyable learning experience. How to motivate students will be discussed in the face-to-face sessions. The most important word in our vision is to lead. Ain Shams Medical School is already leading medical education development in Egypt. The competition is hard, but we intend to keep our leading position. We practice our values, and we insist to provide a role model. In this presentation, I'm going to briefly review the program map. For detailed information, please visit the program's website. The extended modular program is a 6.5-year program delivered in 2 phases. Preclinical Foundation, Phase 1, and Clinical Clerkship, Phase 2. Phase 1, the first 3 years, presents the basic science foundation for medicine. It is delivered in an integrated form that is based on body systems. For example, in Year 2, students study the cardiovascular module. This includes the macrostructure of the cardiovascular system, anatomy, the microstructure, histology, the normal function, physiology, related topics in molecular biology and biochemistry, the diseases affecting the cardiovascular system, pathology, the drugs acting on the cardiovascular system, pharmacology, related topics in microbiology. These topics are presented in the proper logical sequence, and this goes for all the body systems. This integrated approach connects related information and helps students to avoid unnecessary repetition. It helps them as well to form their own mental network and make sense of the basic science knowledge delivered. In parallel, students are introduced early, that is from Year 1, to the basic concepts of doctor-patient interview, including introduction to history taking and examination of the studied body modules. The clinical examination stresses on the normal while giving classical prototypes of the abnormal. This early clinical exposure aims to relate the basic science knowledge to its clinical applications. The main emphasis is on the systematic approach to the patient based on a simplified checklist. The student learns to ask simple but systematic questions to the patient. For example, with jaundice, related to what has been studied in physiology, biochemistry, and pathology. He can also perform systematic clinical examination of the knee joint, for example, based on what has been studied in anatomy. He can as well interpret chest X-ray findings based on what has been studied in anatomy and pathology. The early clinical exposure includes as well field visits. Field visits addresses in context clinical application of the studied basic science topics. For example, how to connect ECG leads, how to use inhalers. The problem-oriented, team-based sessions, we call them POT, is another learning activity that helps students view the studied basic science concepts in a clinical context. Working in teams, students are given virtual clinical case scenarios with structured questions or tasks to solve, highlighting again clinical applications. These multidisciplinary sessions proved to be very motivating. So as you can appreciate by now, that students reach the clerkship phase well prepared to be engaged in their clinical activities and to build upon their gained previous experiences. Phase 2, the second 3.5 years, is devoted for clinical clerkship rotations in small groups. A list of core clinical problems, presentations, clinical situations has been prepared by subject experts nominated by the different departments. They considered the Dundee core clinical problems and the Manchester's lists of index clinical situations as basic benchmarks. This list needs your contribution as subject experts for further refinement, for possible missing or overlapping presentations or problems. This list will be the base for the integrated clerkship guide and activity logbook. In clinical rotations, students will rotate in small groups. Their clinical day includes a chain of learning activities. A more detailed plan of the clinical group rotations has been sent to you by email. The chain of learning activities and the rationale will be discussed within the face-to-face sessions. The final semester, that is semester 13 in year 6, is an integrated longitudinal clinical clerkship. This concept has been introduced by Harvard Medical School in 2006 and has been increasingly adopted by leading medical schools around the world. If you are interested to read more about the longitudinal integrated clerkship, you can visit this website and review the article. Community medicine learning activities are integrated with the relevant clinical topics across the 3 years of the clerkship phase. Forensic and toxicology course is positioned in the 6th year. The thread of personal and professional development continues. Finally, a commonly asked question is, what does the word extended means? We use the word extended because the program courses extends beyond the traditional medical content to include personal and professional development topics addressing learning skills, thinking skills, communication skills, research methodology, evidence assimilation, and basic life support as a core content for all students. The program offers as well optional summer courses in healthcare management, basic medical education, and healthcare quality assurance. These courses are simple introduction to the topics where students can explore early optional career pathways. If you are interested to know more details about these programs, please visit the program website. We expect you to be open-minded, accept new ideas, generate new ideas, cooperate with each other, apply any good practice whenever possible to the mainstream students, as we aim actually to change the whole faculty and be an integral part of the EMP family. Adopting modern educational strategies is possible. Students do engage, progress, and excel. The extended modular program is building a growing reputation of success. As you join the program, we count on you and your active collaboration to continue this story of success. If you have any further questions, please be ready with them in the face-to-face session. Thank you.